828. We have a very special guest on the phone now. Dr. Tabatha Downey, Chief Medical Officer from the Heart of Florida.
I hear you guys are prepping for the next phase.
Quote unquote.
So what is the next phase?
And how many phases?
Yeah. Oh, yeah. How many?
Well, as you know, the community has been overall prepping for handling a surge of COVID-19 patients. There are several aspects of the next phase. Actually, one being to prepare for reopening of society, so to speak. We anticipate that there will be a need for testing to help people understand what their risk factors are. So that means that a lot of people will need to be tested probably to go back to work or to know if they are an asymptomatic carrier of the virus. That's our initial first steps, is to make testing more available. And so what we have done is we have relaxed our screening criteria, and we will essentially test anybody in the community who needs to be tested, just so that even if they don't have symptoms, they can know if they are a carrier or not, and they can know if they can safely be around other people. The next phase is going to be able to identify people who might not have any symptoms. And so that new criteria pretty much will be persons who want to re-enter their normal routine or ease back into their normal routine, but also want to have an assurance that they're at least not carrying the virus asymptomatically. So the types of patients that we anticipate will be those who are about to go back to work, whether they, work in the public or they work in the schools, work in construction, restaurants, those types of things. And then if there are people who previously tested positive and now don't have any symptoms, it would make sense to retest those people to make sure they're not actively with the virus so that they would not be a continued risk to public safety.
So can you say that, it's to a point now where anybody who wants to be tested can get a test?
For the Heart of Florida Health Center, I can say that. I do know that some of the other testing sites are still following a stricter criteria. However, I know that we will test, and I know of 3 other sites in the community that are testing. One of them is by drive-up, and they are not requiring any appointments, and they'll let patients walk up or drive up. I can safely say that in Marion County, if you need a test, you can get a test.
Now, if we've never been to Heart of Florida Health Center, if you're not like our primary doctor, can we still go to you?
Yes, you can. We just require that you still call in and give your demographic information, name, date of birth, insurance information if you have it. But if you don't have insurance, there's no charge. If you have insurance, there's no co-charge. We do charge the insurance company for the visit, but we're not charging any co-payments or any fees associated with the actual testing itself. Those who want to become Heart of Florida patients absolutely can, but if someone just wants to come over because their provider's office is not able to test, they can do that as well. They do have to make an appointment, and they can do that by calling our call center.
And that is 732-6599?
Yes, ma'am.
Okay, wonderful. And, of course, if you're sick, please call first, because there might
do
be...
not walk in.
Yes, absolutely.
Yeah.
Dr. Tabatha Downey, Chief Medical Officer, Heart of Florida Health Center.
Could you just real quickly speak on the flattening of the curve here in Florida at all?
I do notice that there is a flattening of the curve. And in fact, speaking specifically for Marion County, I have not interpreted the surge to be as severe as we had anticipated that it could be. But I'm glad that we were prepared for the worst case scenario, and we are still preparing for the worst case scenario because the situation has been so fluid. However, the number of cases, actual positive cases, has been coming down in Marion County, even though we are continuing to test. And so that's really encouraging. We don't know what's going to happen when we slowly open things up again, but we will continue to monitor, and I'm sure that we will have to react accordingly.
Yes. Oh, wonderful. Well, thank you.
Dr. Tabatha Downey, Chief Medical Officer, Heart of Florida Health Center. One more question. Can I have a note to get out of work tomorrow?
Well, that depends. It'll just be between me and you. I won't tell anybody, okay?
Even though Hunter really is my boss.
Yeah, so. I'm standing right here, and you've got a full audience out there listening. Dr. Tabatha Downey, Chief Medical Officer, Heart of Florida Health Center. The number again, 732-6599. And this is the location that's right next to Big Lots on East Silver Springs Boulevard, right?
Actually,
Oh, no, you're
our
downtown.
I'm physically located downtown, but our testing site is actually at our southwest location. It's at 100 Marion Oaks Boulevard in Ocala.
Oh, okay. All right. Yeah. All right, cool. Well, look at all the information you gave us.
Okay, and you're about to hang up on her.
No, I...
Well, you were trying to get out of work.
Exactly. Stop trying to turn the attention on me.
Okay, now we can hang up on her.
Dr. Downey, thank you so much for all the information this morning.
Absolutely. Thank you. You guys be safe.
It's Hunter and Parker.
I will